My name is Tyler. I'm going to be your nurse today. Before we begin our assessment, which is going to be of the abdomen today, can you please tell me your name and date of birth?
Caitlin Miller, 10/19/02.
Okay, excellent. So first thing before we start, I'm going to perform some hand hygiene, put on some gloves, and then we'll get started, okay?
Okay.
I am just going to do a general assessment of you, just make sure everything looks okay before we get started. So you do look like you're relaxed. Don't seem to be any pain or discomfort right now. Everything looks normal. No distension that I see. So first thing I'm gonna have you do is I'm just gonna have you lay flat on this table, and I'm gonna be assessing your abdomen, okay?
Okay.
So go ahead and just lay flat for me. Okay, so the next part of our assessment is I'm just going to be listening to your abdomen regions. I'm going to move in 4 different quadrants just to listen to your bowel sounds, okay?
Okay.
So I'm just going to grab my stethoscope. And this first time, I'm going to be using the diaphragm, which is my larger side of my stethoscope, okay? So you can just breathe normal, and I'm just going to move around as you breathe, okay?
Okay.
Okay. Bowel sounds are all active, sound normoactive to me. Don't hear anything abnormal there. So everything sounds good. So we'll go ahead and move on, okay?
Okay.
Okay, so the next stage of our abdominal assessment is I'm just going to move my stethoscope around. This time I'm going to be listening for any abnormal abdominal sounds, such as bruits, is what we call them. So it's an abnormal swooshing sound that's going to be in your abdomen. So I'm going to assess 4 different areas. I'm going to listen to the aortic, the renal, the iliac, femoral, and then I'm going to listen to see if you have any signs of a venous hum, okay?
Okay.
So let me go and get started with the bell side of the stethoscope. Okay, just go and breathe normal for me. I'm going to move around here. Okay, and the last one we'll do is the femoral. So this one's just going to be a couple inches below your umbilicus. Okay, good. And I'm also assessing for a venous hum while I'm assessing you as well. And I don't hear anything abnormal in any of those quadrants or any of those areas. So I don't believe we have any signs of a bruit, and no venous hum is present. So that's great. So we'll move on, okay? All right, so the next part of our assessment is I'm just going to be palpating, which is just feeling your abdomen for any tenderness, any masses, any surface or any problems in there. So I'm just going to start lightly, and I'm going to palpate about 1 to 2 centimeters through each quadrant. And I want you to tell me if you feel any pain as I palpate, okay?
Okay.
So start up here. Do you feel any pain when I do that?
No.
No? Okay. Still no pain?
No.
Good. Okay. So the next one we're going to do is I'm going to keep palpating, but this time I'm going to go a little bit deeper. Still doing okay?
Yep.
Good. Okay, excellent. All right, and then the last part while I'm palpating here is I'm going to also feel for an aortic pulsation, which is going to be in your left upper quadrant, just to the left of the umbilicus. So I'm going to go just a little bit deep just so I can feel that pulsation, okay?
Okay.
Okay, and I do feel aortic pulsation, feels nice and strong. Feels good, okay. So that is all good, and you're still okay, no additional pain since I stopped?
Mm-mm.
Okay, good. So with that, we will go ahead and move on.
Okay.
Okay, so the next part of our assessment is I'm just going to palpate around your umbilicus area, and I'm just feeling for any bulges, nodules, and I'm going to feel for the umbilical ring around, okay?
Okay.
Again, still no pain or tenderness when I do that?
No.
Okay, good. So umbilical ring feels good, feels round and regular, and I don't feel any bulges or nodules or anything abnormal there, so that feels good. And we'll go ahead and move on to the next step. All right, so now we are on the final step of our abdominal assessment. So with this step, I'm just gonna be percussing your back here to assess for any kidney problems by assessing the costovertebral tenderness on your back. So what I do is I find your 12th rib and your spine, and I'm just gonna percuss in between this spot just to see if you have any tenderness in your kidneys, okay?
Okay.
Okay, you feel anything with that?
No.
Good. Okay, and we'll do the other side. Okay, anything there?
No. No pain.
All right, good, no pain. So I believe that is everything I have for you in terms of our abdominal assessment. Do you have any questions for me at this time?
No, I don't.
Okay.